So, as you said, my name is Joshua Zweigle. I am one of the internal medicine residents at ECU Health Medical Center and Brody School of Medicine here in Greenville, North Carolina. I'll be presenting a case about a hepatocellular carcinoma, presenting in a very interesting patient that we had here with a solitary scalp metastasis. I'd like to thank the SMA for having me here, and let me share this wonderful case with you guys. So, we have a patient that coming in here, and just a little bit of background on hepatocellular carcinoma. It affects about 30,000 patients every year. So it's not necessarily something rare that we see. It's just the presentation of this patient's a little bit different. So we have a 56-year-old Caucasian male coming into our emergency department. He'd been complaining about a lump on his head. It had been there for about a month. He really didn't notice anything prior to the month, no itching with it. He had no nausea, no vomiting, and no drainage from this lump. He did have some blurred vision. He said that was kind of worse in the mornings, but it really wasn't bothering him very much. And he had just been noticing this lump for a while and really wanted to get it checked out. So he came into our emergency department. He was feeling pretty well. He didn't have any stigmata of any liver disease. He didn't have any focal neurologic deficits apart from the blurred vision in the mornings. And apart from that, he didn't have any abdominal complaints at all. He did not have any right upper quadrant tenderness. He didn't have any ascites. And really the only thing that he was coming in for was this mass. And you can see it here in the bottom left-hand corner. It's dark, it's rough, it's a bit variegated on the top of it, but it was really kind of in the shape of an oval. And in the longest direction, it was about 5 centimeters in width. So it was also very hard, which is something that can be a bit of a tip off for some of these. So it definitely was just as hard as the skull that was around it. So he got a full workup in our emergency department. Really, the labs were not coming back with anything interesting except for a positivity for hepatitis C. And he got a CT scan done in the emergency department. Showed this lytic calvarial mass, but they were saying, per our radiologist, there was no meningeal penetration with this mass. So he got a core biopsy and was followed up with in the outpatient setting, but his core biopsy was consistent with metastatic hepatocellular carcinoma. So he came back for CT. Now, just a little bit of background on hepatocellular carcinoma. It's very interesting. We got a biopsy of it, but often we will not get a biopsy of these specific types of lesions because if you're suspecting hepatocellular carcinoma, you can usually get an MRI of the abdomen, and if it's done correctly, you can actually diagnose hepatocellular carcinoma on the MRI. Unfortunately for our patient, he was a veteran and he had a few bullet fragments in his abdomen, so he was unable to get an MRI done. So we went ahead and got a CT of his chest and abdomen and found this mass in the right lobe of the liver. It is 3.6 by 3.7 centimeters. And we're assuming that this is the original lesion from the hepatocellular carcinoma, but apart from the skull metastasis, we actually found no other metastases anywhere. It's a bit rare to be seeing this kind of thing because usually you're going to see hepatocellular carcinoma go to the lymph nodes, or you'll be seeing it go to the lungs. Often you'll see it go to the bones, but for it to have such a one distant metastasis is not very consistent. His alpha fetoprotein level was low the entire time. Prior to this, he got it measured just after he was in the emergency department. He still was having very few symptoms, but he eventually was having some significant ones over the next couple of weeks. And he went ahead and got some stereotactic beam radiation therapy. This is CyberKnife on that calvarial lesion on his head. And apart from that, he also got a radioembolization of the right hepatic artery to take care of that lesion in the right lobe. He was treated with bevacizumab and atezolizumab, and this is for overall chemotherapy. And then after that, he was treated with lenvatinib. So this patient actually did not do very well. Over the course of about 3 months, he was significantly declining, ended up opting to go into hospice and passed about a month later. So just as a bit of a overview for you guys here for hepatocellular cancer. It has a very high mortality rate where usually the mortality rate survival is about 21% in the first year. It's been found to be about 7% 3 years in. And a big reason for this is that a lot of these patients actually don't get diagnosed until after they have metastatic disease. So often you're going to be seeing these patients after they're metastatic, very much like our patient here. It is the only solid tumor that does not need a biopsy, and it can be diagnosed on an MRI if it's done correctly. And it will be in higher rates for patients with hepatitis B and hepatitis C. Our patient didn't know exactly where he got the hepatitis C from, but he was in that age range where some of these patients can have it more often. So just overall, a big thing with this is that this patient came in for a skin lesion. He came in for a lesion on the head, and we're seeing a lot of these patients and we're not necessarily thinking about metastatic workup. So with some of these patients with very different lesions, we definitely want to be thinking a little bit about metastatic disease, and they don't always have to have other symptoms necessarily of weight loss, especially for hepatocellular carcinoma. We won't always see that as the presenting symptom. Often it'll be some of these metastatic lesions. So it really needs a thorough history and physical examination on these patients. And just for a take-home point to remember that hepatocellular carcinoma is the only solid tumor cancer. It doesn't necessarily require a biopsy of the liver if you can get a good MRI. Thank you so much for your time. Thank you to the senior investigators who are helping me with this in the oncology department here at ECU Health. I'll take any questions.